Hey guys, Dr. Barron here with virtualheadachespecialist.com. You guys have asked a ton of questions about migraine with aura, stroke, estrogen use, birth control use. So I want to just address those questions and try to put this all in one focused talk. So there's a lot of question that I've seen pop up in the feed. Is there a risk of stroke with migraine? And it's a complicated answer, but the answer is yes, there is an association with stroke and migraine, and specifically in women that have migraine with aura. This is not common, but it's something to be aware of, and I want to just go over those issues. So, when you see a stroke that occurs in the setting of a migraine, the most common scenario, when it rarely happens, is that it's a stroke that comes from some other predisposition of having stroke for that person. And this is a separate conversation of those risk factors, but basically the area of stroke triggers the migraine aura by injury to the brain, the cortex of the brain. You can see my other video about migraine aura, about how it's this electrical wave that spreads, but it triggers that electrical wave of aura. And so this is the most common scenario. If you do have a rare event of stroke in the setting of migraine, the stroke actually will usually trigger the migraine. Now, there is a very rare phenomenon called migrainous infarction or migrainous stroke. This happens when there's a stroke that occurs in the setting of a migraine aura, which is lasting greater than 60 minutes. And the stroke is seen on neuroimaging, preferably in an MRI, and the stroke occurs in the anatomical area of that aura. So, for example, somebody has an aphasia aura, the stroke would be located in the language center of the brain. All other causes obviously have to be excluded before assuming this. There are theories of why a stroke can occur in relation to the migraine itself. This is beyond the scope of today and what we're talking about, but I just wanted to mention that yes, there is a possibility of stroke caused by a migraine event, which is very rare, but it's something to be aware of. So let's talk about stroke risk. Who really is at risk of stroke with migraine? And so what it really boils down to at this point is that women who are under age 45 who have migraine with aura specifically, so migraine without aura is not an issue. It's migraine with aura. Those women have about a twofold increased risk of stroke. Although the absolute risk of this is still very low, it's something to be aware of. Now, the problem happens when you add estrogen from a combined hormonal contraception into the mix. That stroke risk goes up about sixfold in that person who has migraine with aura in women. And so, and when I say combined hormonal contraception, this is a standard pill, combined progesterone and estrogen. Now, even more concerning is that this risk skyrockets to 9-fold increased risk of stroke in women who have migraine with aura, who are using estrogen-containing birth control, and who are smokers. So if you have migraine with aura, you cannot be a smoker and use estrogen-containing contraception. It really should be considered off limits. You should consider non-estrogen birth control methods, progesterone-only options, which are not an issue with stroke, IUD placements, these kind of options. And in your OB, you can talk about other options with them. Also, you should not use combined hormonal contraception with estrogen if you have prolonged migraine aura. So if you have migraine aura that lasts greater than 60 minutes, if you have migraine aura with focal neurological features such as hemiplegic migraine, what we now call migraine with motor aura, basilar migraine, which we call brainstem aura, one-sided numbness, aphasia aura, we typically suggest to avoid estrogen-containing birth control in these scenarios. So who can use combined hormonal contraception with estrogen safely? So the issues that Combined hormonal contraceptive use with estrogen in non-smoking women with migraine with aura is fairly controversial. Guidelines vary, so I want to just go over the most common guidelines that we try to make our decisions by. So first of all, the International Headache Society says that low-dose estrogen can be prescribed in migraine with simple visual aura, meaning that you get the visual scintillating scotomas, zigzags, whatever it might be. Should last well under 60 minutes, hopefully more like 15 to 30 minutes. Those patients, if they are non-smokers, regardless of their age, is considered okay to use combined hormonal contraception. The lowest dose estrogen is always preferable. But even so, this still needs a conversation with your doctor to individualize the decision for whether to use estrogen-containing hormone therapy to weigh the risks and the benefits. The risks of using these therapies and things that would steer you from not using estrogen in these patients that have migraine with aura, that are non-smokers and otherwise simple visual aura, would be if there's stroke risk factor. So family history of early heart disease or stroke under age 60, atrial fibrillation, which is an irregular heart rhythm that causes stroke, smoking history, off the table, not a question. You don't want to use estrogen with that and migraine with aura. Uncontrolled hypertension, cholesterol, diabetes, obesity, systemic diseases that are associated with increased stroke risk, such as some connective tissue diseases, sickle cell disease, blood clotting disorders, if you've had DVTs or blood clots, PFOs or patent foraminal valleys. These are things that we would lean towards avoiding the estrogen in these patients if we can. Now, in contrast, the World Health Organization and the American College of Obstetrics and Gynecology, their guidelines are that non-smoking women under age 35 who have migraine with aura without any other stroke risk factors felt to be generally an acceptable low risk of combined hormonal contraception with estrogen. Now, once you get women that are older than 35, or smokers regardless of age, even if they're under 35 and smokers, the recommendation would be not to use estrogen. But in these women, the risk is felt to be unacceptably higher, and they suggest avoiding combined hormonal contraception with estrogen in women who fit these guidelines. So women greater than 35 or women who are smokers under 35. Now the CDC, the Centers for Disease Control, U.S. medical eligibility criteria for contraceptive use says to avoid combined hormonal contraception in migraine with aura. So that's another hit against the use of estrogen in migraine with aura. And really it comes down to the bottom line being that using combined hormonal contraception containing estrogen in migraine with aura, if you are a female, requires a conversation with your doctor, because there's a lot of personal issues that need to be weighed for risk versus benefit. The guidelines and the guidance that I mentioned above, this should all be taken into account when talking to your doctor. So hopefully that gives you some guidance, but it's a gray area. It's not a black and white answer for some cases, but I think these guidelines give you a pretty clear direction of when to use estrogen-containing combined hormonal contraception and when not to use it. Okay, guys, have a good weekend. Bye.